Femur is the longest and strongest bone in the body. The entire weight of the body is transferred through this bone and associated joint at each end. Therefore, these joints are a frequent source of pathology when trauma occurs. The proximal femur consists of 4 essential parts: the head, neck, greater and lesser trapeze. The angle of proximal femur. First, neck to shaft approximately 125 degree. Second, longitudinal approximately 10 degree. Third, anterior angle 15 to 20 degree. Next, as for the clinical indication of lateral femur, we must include the mid, distal and proximal femur, including knee joint and lateral hip, for detection and evaluation of fractures and or bone lesion. Next, what is proximal femur fractures? These fractures are common in older adult or geriatric patients with osteoporosis or avascular necrosis. Both osteoporosis, that is loss of bone mass from metabolic or other factors, and avascular, loss of blood circulation, necrosis is cell death, frequently lead to weakening or collapse of weight-bearing joints, such as a hip joint. Fractures occur with only minimal trauma. Now, let's take a look of how to do the projection of femur lateral.
Assalamualaikum warahmatullahi wabarakatuh. My name is Syarifah Radhiah. Today we're gonna do a procedure of X-ray femur lateral. So first thing first, we're gonna choose the cassette and set the exposure. Okay, come follow me. So for the femur lateral, we're gonna use the cassette 2543, which is this cassette. And after that, we'll set the exposure. So as the femur, we will choose the direct pattern, chamber of direct pattern, and the KVP is 70, and MAS is 8. Okay, so we're gonna go inside and set up the room. Lower the table baki for the patient to put in at the table baki. And then we're gonna prepare the protection. So for my protection for this X-ray examination, we're gonna use only the thyroid shield to protect our thyroid. So we prepare it here. It's done, and then you can call the patient. So next, we're going to call the patient. Miss Sakina binti Muhammad Faiz. Yes. Okay. So please sit there first. Okay. Now I come to your name. Is it your name is Sakina binti Muhammad Faiz? Yes. May you say your ID number?
My ID number is 040715100352.
Okay, that's right. Okay. When is your first day of your latest menstrual period?
Yesterday.
Yesterday. Okay, that's okay. So then we're gonna change your clothes into the hospital gown, and the opening is the back. Okay. And that's all. Okay. I have you.
Sure.
And you can tell me when you are. Miss Sakina, are you done? Okay, so you want to sit at the table baki. Just have to. Okay, sit here. Take off your shoes. Can you move your hips up a little bit? Okay, put it down. So we're gonna wear this protection to protect your thyroid, okay? Okay, can you move your this leg? Okay, and your body like this. Okay. I'm sorry, I touched a little bit, okay? Are you comfortable? Okay.
This is comfortable.
Okay. Wait for a minute, okay? Can you spread your leg a little bit? Move up your hips. Okay. Can you move your feet a little bit? Okay. Okay, stay still and don't move, okay? If I say you stay still and outside, you have to stay still, okay? Okay. Stay still, okay? Okay, Miss Sakina? Can you hear me? Okay. Please stay still. 1, 2, 3, shooting. Okay, Miss Sakina, we are done. Can you have you? For a minute, okay? Okay. Okay, now you can go change back your clothes, okay?
Thank you.
And all the doctor will brief you.
Okay. Thank you.
And it's done.
The first thing you must do when you want to do an X-ray examination is that you must do a room preparation. First, tidy up X-ray room before receiving patient. Second, ensure the availability of immobilization aids, chairs, stool, grid, and etc. Third, prepare the protection shielding apparatus. Fourth, set the exposure factor. And lastly, prepare enough and suitable size of image receptor IR. Next, patient identification. We must make sure it was the correct patient. First, call in patient by his or her full name. If there are 2 or 3 patients with similar name, check their IC, date of birth, address or other information stated on request form. Or you can check on patient wristband ID or check on patient's folder. Second, we must make sure it was the correct examination. We can reconfirm with the patient site or area of interest. If different, we must consult with the referring physician, or we can check at the patient folder if available. Next, the patient preparation. First, you must introduce yourself to patient. Second, explain the procedure and offering the patient the opportunity to ask the question. Third, you must ask the patient for their last menstrual cycle period and check for pregnancy possibility according to the 10 days rule. Fourth, you must ask your patient to put on a snapless hospital gown with an opening at the back. Lastly, assist the patient to the table baki. Next, what is LMP rule, 10 days and 28 days rule? It means that all radiological examination involving pelvis and lower abdomen should be scheduled during first 10 days following onset of menstruation. No conception will have occurred. Next, for the technical factors, as you can see in the video, we must set up the exposure and choose the cassette. The minimum SID for lateral femur is 100 cm from the beam to the IR. The IR or the cassette size we must use is 35 x 43 cm. The cassette must be placed portrait and grid. As for the exposure, the kVp range is 70 to 80 kVp, and I use 70 kVp for my patient Miss Sakina, and I use 8 for the MAS. The kVp must be selected based on our patient and the part we want to do a X-ray. The next thing is shielding. Shielding is one of the most important things when we want to do a X-ray examination. What is the function of shielding? Shielding is to shield the radiosensitive tissue outside region of interest. We must ensure shielding does not obscure any aspect of femur. So for lateral femur, I use only a thyroid shield. Next, for the patient position, we must place the patient in lateral recumbent position or supine for trauma patient, with affected side down and provide pillow for head. Next, for the patient position, we must place the part position for lateral recumbent. Firstly, we must flex the knee approximately 45 degrees with patient on affected side and align femur to midline IR. Next, we must extend and support unaffected leg behind affected knee and have patient roll back posteriorly 15 degrees to prevent superimposition of proximal femur and hip joint. We must adjust IR to include hip joint considering the divergence of the X-ray beam. We must palpate the axis and place under IR margin at this level of this landmark. Next, the part position for lateral recumbent. Next, the CR. CRs must be perpendicular to femur and directed to midpoint of IR. Next, for the collimation, we must collimate closely on both sides to femur with end collimation to IR border. So, for the diagnostic acceptability criteria for anatomy demonstrated, we must make sure proximal 1/2 to 2/3 of proximal femur, including the hip joint, is shown. Proximal femur and hip joint should not be superimposed by opposite limb. The next criteria is position. The position must be in true lateral. Superimpose of greater Ellipsoid trochanterus by the femur axis with only a small part of the greater trochanterus visible on medial side. Most of the greater trochanterus should be superimposed by the neck of the femur. Femur should be centered to collimation field with hip joint, a minimum of 1 inch or 2.5 cm from proximal IR margin. And for collimation is we must collimate it to the area of interest. Criteria is exposure. Optimal exposure with correct use of anode hill effect or use of compensating filter will result in near uniform density, that is brightness, of entire femur. We must make sure there is no motion is present. Frontrabecular marking should be clear and sharp throughout length of femur.